I do think that we have a very significant susceptibility to complex health pictures or burnout symptoms, or some of these health concerns that we're talking about, um, because we process the world as deeply as we do.
Welcome to Sensitive Stories. This episode is for educational purposes only and is not intended as a substitute for treatment with a mental health or medical professional. Let's dive in. Hi, Karen. I'm so happy to talk with you today on the podcast.
Thank you. I am so happy to be here and to get to chat about one of my all-time favorite things, sensitivity. This is really exciting for me.
Yeah, same. And just hearing your expertise and perspective on our sensitive experience with burnout and energy management. And I'm sure there's so many other topics we could cover. Might have to have a part two. But before we get into that, I'd love to start off and just hear a little bit more about your own HSP discovery story. How and when you realized that you're a highly sensitive person.
Yeah. I appreciate that you say highly sensitive, because I was told I was sensitive my whole life, right? I mean, I'm sure so many of us hear that.
Yeah.
And growing up, I definitely always felt things deeply, emotions, energies in the room, or even just the way that my body and other people's bodies responded to stress. It was always very apparent to me. And it wasn't until I read Elaine's work, which was about 20 years ago now, that I thought, oh, yeah, you get it, right?
Yes, the puzzle pieces start coming together.
Wow,
Yes.
wow. I hope that someday I can, maybe I could just send her a thank you. I mean, it just was so transformative.
I mean,
Yeah,
it's incredible just to have that insight of going from, okay, I've been called sensitive, just that generic term, but then to realize, oh, there's more to it. It's a trait. There's a framework. There's language for it. It is
yes,
so illuminating to have that light bulb come on, like, oh, now it all makes sense. At least that was what it was for me. Finally.
absolutely. Absolutely. It really did. So much came together for me at
Yeah.
that point. And then right around that time is when I went to naturopathic medical school, and I started to notice that the sensitive people in my program and I had different nutritional needs. And then I mean, it was just very, very serendipitous, like it was time for me to awaken that awareness. And then I realized, okay, I'm a highly sensitive person, and my approach to well-being looks different
Yeah.
than others, beyond the bath and the downtime and,
Yes.
all of these other things.
Yes.
It was also making sure that I was learning how to replenish these nutrients. And it was just the tip of the iceberg, for a really passionate journey for me.
Mm. Mm-hmm.
Really grateful to get to do these things in my work, because I feel like this is my purpose. And I think as sensitive people, like, our connection to our purpose, I know it's important for everyone. I don't know why. I just feel as being highly sensitive, it's almost non-negotiable, to really thrive.
Agreed, agreed. I think because we are so connected to our internal experience, our emotional landscape,
Mm,
when there's that sense of disconnection or lack of purpose or even boredom, we feel it so much more deeply. So I am in agreement with you. I think purpose and alignment with what we're doing in our kind of our life's work is so
yes.
much more important for us.
I think
And
that's beautifully stated. Yes.
mm-hmm.
You feel it.
You feel it, right?
So deeply. We can't ignore it. And
No.
that's why, not to get too far off
Yeah.
our topic, but I guess it's not far off because it is.
No.
Um, I think that there is this, whatever anybody's beliefs are, like, bigger reason for us, aside from evolutionarily, right? I mean,
Mm-hmm.
that's clear, that makes sense.
Yep.
I don't know. I feel like we're kind of like the heart. And actually you mentioned that in your podcast, and I love that. Uh,
Yes.
we are the heart of
Hmm.
our species, you know, and we can't ignore certain things. And, sometimes it's the canary in the coal mine type of
Hmm.
situation. And sometimes it's, we can do better.
Yes.
Have to do
Right. We're
better.
really elevating the expectations or the standards,
I
right?
think so.
I do. I think
I
that's part of our purpose here.
Yes, I completely agree. Sometimes it can almost sound a little grandiose, but I don't know. I don't think it's grandiose. I think we're special, in that regard. But
Yeah.
other people will say we're not special because we can't do mass production of work, right? So it's
Right.
all
But I see it as, everybody is special in their own way. The people that are non-HSPs, more extroverted, whatever it is, they have a purpose too. It's just different than ours, right? I mean, we're the noticers, the feelers, the emotional leaders, and let's not discredit that,
yeah,
right?
absolutely. And I think it's particularly special in at least the way I see it because I love those things.
Yes.
So I'm like, that's so special. It's
Right?
extra special.
Right. It's so meaningful to us.
Yeah, it is.
Yeah. And yeah, purpose is so important because of that.
Yeah.
Yeah. You mentioned nutritional deficiencies, and I know we might talk about this later, but I didn't want to lose that
Yeah.
moment. You said, when you started studying naturopathic medicine, you realized, oh, I have different nutritional needs. So,
Mhm.
I think that's an important layer to be able to find purpose, to be able to live well, to not feel like we are living under that fog of overwhelm and burnout, which we'll talk about. I wonder if you could just say a few things about that, what you were noticing.
Yeah, it first came to my awareness during school when we were talking about vitamin C. And one of the ways that we naturopathically assess vitamin C, because you can do an expensive specialty test that will do like a micronutrient test that tells you, what kinds of nutrients you're low on or high on, and then that can have some implications. But there's a really easy way to test it with your bowel tolerance.
Oh.
And and so you can do 500 for sensitive people. I usually recommend like 250 to 500 milligram increments. Non-HSPs jump to 1 to 3
Mm.
grams. But sensitive people, it can go either way. There can be a super high um, requirement for it or really low.
Mm.
So I noticed that there were about 100 of us in our class, and the people that I kind of had tagged as
Mm-hmm.
HSPs, we're all talking about having had much higher bowel tolerance for vitamin C, which is particularly fascinating because vitamin C is important in the conversion and the production of epinephrine and these stimulating fight or flight types of brain chemicals and
Mm-hmm.
neurotransmitters. And to me, once I put that together, which was very similar timing to Elaine's work, and me being exposed to it, I was like, oh man, there is so much here.
Yes.
Yeah. So it started with vitamin C.
I mean, there's so much because we talk a lot about our emotional differences, our nervous system differences, but why wouldn't there also then be nutritional differences?
Of course.
Because we're living in an interconnected system. I know we treat our bodies as these separate silos,
Mm,
but it's all part of the same system.
yeah.
What an interesting discovery. I imagine, having worked with more and more HSPs over the years, you've been able to see more of that.
100%. Yeah.
Yes. So we
Yeah.
really do need to take care of our bodies differently as well as our emotions.
100%. Yeah. It's
Yes.
in order to, especially to be able to thrive in the way that I want all HSPs to thrive,
Yes.
right? Like what an amazing world we would live in if we felt really nourished and grounded and in a place
Yes.
we can shine as
Hmm.
brightly as we know is possible.
Right. Exactly. It's like we just need something different
Yes.
to be able to do that.
Yes.
Um,
Yeah.
so in your work with HSPs, I know you've personally struggle with burnout, but I imagine see that a lot, whether it's burnout or energy depletion or other physical symptoms. Um, I'm just curious if you could share a little bit more about what those signs of burnout might be, nutritionally or physically or emotionally, that you're picking up in your practice.
Yes. You know, the easiest way to answer that, and we can get into the specifics, but the easiest way to answer that is the experience of a highly sensitive person when it becomes painful is,
Mm,
is the and is sustained, right? So the
mm,
overstimulation, the for some of us, emotional reactivity, emotional exhaustion, increased sensitivity. So all of the things that can be wonderful gifts kind of feel like they're working against us. And when we're there for an extended period of time, I think as HSPs, we always have, you know, once a week or maybe at the end of the day where it's like, oh, okay, it's time. It's time
yes.
for me to, stow myself away. I will see you all tomorrow.
Mm-hmm.
But if that's the state that somebody is in, really continuously, then it's worth exploring. Sleep issues become really prevalent during
Mm-hmm.
burnout. A lack of joy or passion, which is that light, that I would love all sensitive people to connect with and
Mm-hmm.
shine. Immune system starts to get really wonky. So if we're exposed to high levels of cortisol for an extended period of time, then that becomes has an immunosuppressive effect. And so we'll start to see, frequent colds, or if somebody has an autoimmune condition, then more flares of that autoimmune condition.
Mm-hmm.
Um, Food cravings can also come up with burnout, especially salty or sweet, which is like, okay, well, then what else is left? Right. But those are really common for adrenal fatigue, brain fog, increased indecisiveness. I know we all, as we tend to be very intentional about our choices and our decisions, but if it's just feeling like you can't get to um, a conclusion or make a decision, and it's taking over, in different elements, like per procrastination or perfectionism also tend to flare. And these are all things that I think we as sensitive people will come in and out of, but it's that constant state. And what it really comes down to is when the nervous system gets stuck in that sympathetic or fight or flight state, that leads to burnout, because it's just the foot pressing on the gas constantly. And that is
Mm-hmm.
really incompatible with sustainability, especially for a sensitive person.
Absolutely. You can't be in that dysregulated state, that depletive state for extended periods. Yeah, one day a week, the end of days when you've gone through and you've done all that you can. But if you're stuck in that, it sounds like every system of the body is then impacted.
Yeah,
Yeah.
yeah,
Mm-hmm.
exactly. I actually put together a little quiz, very, very old school, um, like do it manually, like those old magazine quizzes. And I put it on my website because I'm just not tech savvy, and I wish I was, but I'm not. And it's a nice resource if people are, curious about that. I can give you that information because I don't think I mentioned it earlier.
Yeah, that would be great. I'll put that in the show notes for people.
Sounds good.
Yeah. Yeah, because I know there can be a lot of different signs that you're going through burnout, and they may not always be obvious, right? Or maybe what you would think.
Yeah. Yeah. And I think that when we get into that state of burnout and things feel so stuck, and I mean, I think I was in a constant state of burnout until I learned about how to take care of myself. So it was like from, I think, probably puberty, right? When hormones came on the scene
Hmm.
and life got so much more complicated,
Yeah.
uh, especially with my sensitivity. It was just constantly feeling burnt out. And when we get into that state of stuckness, there is this, we feel so profoundly under-resourced that the idea of anything changing feels absolutely impossible. And so we kind of fall into a state of hopelessness or helplessness. And it's not that, right? There is absolutely ways for each individual sensitive person to find a way out of it. And I think that's why I feel so passionate about it, because I know what that feels like. And it sometimes can just feel so the solutions can feel so distant and impossible because we're so under-resourced.
Yeah, we're living in that chronic under-resourced space as HSPs often, either because of circumstances or we do it to ourselves, not realizing that we should or could treat ourselves differently. So how do we start to come out if we are in that sense of hopelessness?
I think, I mean, knowing that there is, you know, there is a way. For me, I think that exploring, when I learned that there were different nutritional needs for sensitive people, it was like a whole world was opened up to me. And all of a sudden I felt like I needed to learn it, which was quite the feat, because I didn't have anybody really there in the naturopathic world. There are many providers that are certainly way more sensitive than non-HSP, conventional medicine providers, but not all naturopathic doctors are highly sensitive. And oftentimes some are and don't know it, or still kind of function on a more conventional um, paradigm. And so I had a wonderful naturopathic doctor who understood my sensitivity as best as she could, and honored it. And that was already light years, from the medical gaslighting that I had experienced conventionally. But it was really up to me, to lay that groundwork of, okay, so now I know vitamin C, and that makes sense to me. What about, everything else? And I kind of became a guinea pig. And now for myself and the work that I do. And now I find it so empowering to have, my immune system basket, and my, mental health basket, and my energy basket, and knowing that I have these resources whenever something is feeling a little bit off, is just feels really empowering to me. So kind of like in DBT, we would teach people to have like their self-care basket, which when I learned that was really important for me as well. So it's implementing, these different concepts of self-care that now include physical health, which was really revolutionary for me.
Yeah, we often don't think about the physical health in the context of emotional struggles like burnout. We think of it more as, I'm overwhelmed, I'm overstimulated, but yeah, there's a physical component there. Would you be you differentiate the mental health basket, the immune system basket, the energy basket? Are you open to sharing maybe an example from each of those?
Yeah. So, obviously sensitive people we're very unique in our needs. Um, but I can speak to the things that are most comprehensively well tolerated for sensitive people. It's just, as you've mentioned, this is impossible to be perfect, medical advice, because when working with sensitive people, it's so unique. And that feedback that we get, that live feedback from the body, is really important to take note. But vitamin C, of course. So vitamin C, it's anti-inflammatory. It's everybody knows, supports the immune system, and it has emotionally, it can be emotionally stabilizing, because anytime a nutrient is deficient, the alarm bells go off. So anxiety, depression, fatigue, these are really, really general physical signs that our body's not getting what it needs. And vitamin C plays a role in it plays a role in the hormone system, so the endocrine system, the neurological, mental health, brain chemistry system, the immune system, the I mean, it is very, very prevalent. So it's one that gets you a lot of leverage. And that's why I love to start with vitamin C. There are some this is me going into, the possibility that it might not be good for you, but if some people with oxalate sensitivity, which actually a lot of sensitive people do have, might not respond well to vitamin C. So if ever you are introducing something new, always listen to your body. I can't stress that enough, especially for this population, right? Like we have the ability to be finely tuned instruments. And when we aren't, I mean, that's the experience of burnout, right? Our music starts to sound a little wonky. Whenever your music starts to sound a little wonky, your body isn't aligned. Listen to that. It does not matter what a provider says. Always prioritize that.
That's such a good reminder that we really need to let it be subjective. What is best for me? And in every area of life, like let's not look outward to what everyone else is doing. Let's look inward. And that's, I've experienced that myself, just having over the last year worked with a functional medicine doctor and corrected some deficiencies and seen the inflammation go down and my mental health shift. It's like, wow, it's just a reminder that everything is connected, but to listen to what do I need?
Yes.
So
Yeah.
important, right? Um, yeah, it's
Okay.
so powerful.
Yes. So vitamin C, it sounds
Yeah.
so basic, right? Um, and what else is in my basket? What other baskets do I have? So that's going to be immune. That's a really big one. Magnesium, you're hearing a lot about magnesium. We do tend to have a lot of deficiencies with magnesium because magnesium helps to relax things. And as sensitive people, especially when we're in a state of burnout or are in this kind of reactive fight or flight state, everything gets really constricted, right? Thoughts, bowels, blood vessels, everything gets really tight. And magnesium can help to provide some ease. There's lots of different forms for sleep versus cognitive, anxiety or overthinking types of tension. But generally speaking, you can also you can do bowel tolerance for magnesium as well. So you could start with something like 100 milligrams and add 50 to 100 milligrams every day until there's loose bowels. And then you take a break and then you start back up at 1 or 200 milligrams lower than what triggered the loose stools. Same with vitamin C. So that's a really nice, easy way to test those for yourself. If you have low blood pressure, be careful with that because it will, relax the blood vessels, which can decrease blood pressure. And if there's any kind of bone density problems, because magnesium and calcium will compete for one another. I'm going to pause here because I can talk about this. I
Oh
could talk
yeah.
about this forever, but I want to make sure that we have time to cover the things
No,
that.
this is really helpful because there's so many layers here, right?
Yeah.
And I appreciate the underlying message to like ease in, test
Hmm.
things along the way, reflect, how's it going, make adjustments. Don't just take what you've been told or what the common dose is. And we're kind of skirting around this issue, but I want to bring it more to the surface, which is HSPs often have different reactions to medication, to supplements, to
Hmm.
treatments in general. So it's really important to listen to your body, to
Yes.
maybe start slow and then ramp up
Yes.
with whatever you're taking or doing.
Yes. Yes.
Yes,
Yes.
so
I have
important.
so important. And
Yeah.
I primarily focused my naturopathic work on HSPs for about 10 years. I've always done it, but I wasn't exclusively HSP for until the last 10 years. And during this time, every time somebody comes, and do I have ideas of how something might work out? I have ideas, but ultimately it is their body that is going to dictate how quickly we go. Something fell off my desk. And how quickly we go through any given protocol or what direction we take. And it's so critical that people, HSPs specifically, blank slate every time you start something new. Blank slate as a beginner's mind, right? I know nothing about this and I am here to learn what my body has to tell me and then proceed. because just because your neighbor, who's also an HSP, right? Even within our own trait, we experience a lot of differences. And that, I think, is the foundation of the medical empowerment that I hope that people, HSPs, start to experience with these types of messages.
Yes, empowerment is so important. And I love that reminder. Your neighbor who's an HSP, your friend, your sister, whoever,
Yeah.
even if they're doing this dose or taking this protocol, whatever it is, start from scratch.
Yeah.
What
Yeah.
works for you?
Yeah.
I'm just so in a naturopathic's office, I imagine there's more conversation. There's
Oh,
more room. Um, but what if you're getting a message from a practitioner that is more absolute, more regimented, who's not thinking about a sensitive nervous system?
mhm.
What do you do then?
Yeah.
Because as you're talking, I'm like, this is amazing. This is exactly how I want to show up for my health. But I know not every practitioner is aware of sensitivity or is considering it.
Yeah. Yeah. I have a couple of thoughts about that. One is, if you feel like your provider is constantly saying, well, it can't possibly be that, or just kind of gaslit, like your experience or what you are sharing is completely negated or invalidated, then at that point, I would say I would highly encourage that somebody find a different provider. And this can happen in the functional world, it can happen in the naturopathic world. I have worked with colleagues and professors who were very rigid about how they thought something, a protocol should be executed. And I have something to say about that. But to finish the first section, if you feel that you are invalidated and not heard, I think that's the key. If you feel heard with a provider and they say, your situation is very extreme and you're suffering a lot, and I strongly recommend that we do it this way. And if things go sideways, then we can reevaluate. There's a dialogue,
Yep.
right?
They're actually hearing your experience. They're not shut off to it.
Yes.
Yep.
Yeah. So that's a very important sign. If you are not feeling heard, I feel like that is detrimental to your health. So forget about the fact that, you haven't even started the treatment, right? That I think healing spaces, and as a therapist, you understand the relationship is the primary vehicle for healing. And that is no different in the medical world.
No, it's the foundation. You
Yes,
have to have that in place before anything else happens.
completely agree.
Hmm.
So that's one perspective. If that doesn't feel, if you aren't even at neutral, right? Like if you're starting off neutral and it's not an amazing, relationship, that can still work. But if there's a sense of invalidation, or medical gaslighting, I do think that is more problematic. It's adding to the imbalance that you're there to receive help with. So I would say find a new provider. If you're dealing with something that is really disruptive to your life, right? And you are in a lot of pain, like there's something that is prohibiting you from being able to engage in work or family or just quality of life, then it's possible that a more robust protocol may be in order. And then at that point, if you're working with someone who came really highly recommended, it might be an exception, to everything has to be a conversation. But I would still really, emphasize the importance of feeling heard.
Yeah, that's, I mean, essential, right? And maybe you're varying the degrees of being heard or what you feel is enough if there's other circumstances. It sounds like that has to be there at least in some level.
Yeah, I think so,
Yeah,
without adding toxicity, right, to
right.
a difficult situation.
Hmm.
Having said that, I think most sensitive people can find providers that hear them. You
Yes.
know, And I think and maybe even if somebody is going through something really complicated, like a complex autoimmune condition or something that's not diagnosed yet but is debilitating, maybe it's even more important in those circumstances to find somebody to work with you, because it's oftentimes those cases that are most sensitive to medications and supplements and vitamins and herbs and all of that. And so they need extra care to not feel worse.
Yes, they really do. You're talking about autoimmune and kind of energy levels. Are we destined for these things as HSPs? You know, burnout, sleep issues, autoimmune issues, digestive issues. Is that because you see a lot of HSPs struggling with these
Yeah.
issues?
Yeah. I do think that we have a very significant susceptibility to complex health pictures or burnout symptoms, or some of these health concerns that we're talking about, um, because we process the world as deeply as we do, and every experience of sensory data requires a chemical reaction. So you know, if we see light more brightly or hear sounds more intensely, depending on, or emotions more intensely, depending on what your sensitivity is, or in some cases, like myself, all of the above, each of those is a chemical reaction. And those chemical reactions require nutrients, and they require extra detoxification and a lot of energy to run those chemical reactions and replenish the nutrients. Once again, I like to think of it as baking a cake. So if you bake one cake, you need your eggs and your oil and your water, and then you need the energy to bake it, and then the experience of the cake, right? So the emotion, the sadness or whatever, or if it's a lot of sadness, then it's 10 cakes, that you're baking. Then you got to go back and clean the kitchen. That's the detoxification piece, and restock your pantry. So these are elements that go into physiological self-care for a sensitive person that, a non-HSP doesn't have to think about. They make one cake, maybe five in a day, right? Like we're like cake, 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 cake. We're like this little,
Right, just a hamster wheel of cake
yes,
making.
yes, a hamster wheel of cake making. Yeah. And so they can just eat their regular diet. They can go about, their 80% of the population's self-care, which is just existing, really, and everything, their pantry gets restocked, everything gets cleaned up, and they don't have to think twice about it. But we have a very different internal cellular experience.
I mean,
So that makes us more
yeah.
susceptible, to answer your
This is
question.
no, this is making so much sense because I always think about how much emotional energy we take from processing our experiences. I haven't extended that to think about we need more nutrients or physiological supports. Because right, if we're having all these different chemical reactions in our brain, doing all this processing, our brains are more lit up, taking in all this information. Of course, our body is going to need to pull that energy from somewhere.
Yeah.
And if we're depleted on that level, other systems start to be impacted.
Yes, exactly.
So it's not that we're necessarily susceptible or weak
Yes.
physiologically, it's that we need a different level of input. It seems
Yes.
very just basic,
Yeah.
right? It's not
It's
a
empowering
deficit.
to think that. No, no, it's not weakness. It's not a deficit. It's
Right,
not, I was born to be ill, or I was born to be
right.
not well. It's, I was born to be cared for in a very different way
Yes,
than 80%
exactly.
of the population. And whether or not we had HSP parents, you know, we're just now at a place that I'm able to change the story for my son. But my parents, who one was kind of an HSP, but you know, an officer in the military, like, right, he's going to be the one to teach me. I mean, the poor man, like, so disconnected from his own needs as a sensitive person. So it's very common for, those of us in the certainly 30s and 40s and beyond to not have had any kind of guidance, because they didn't know. They
They
had
didn't
no.
know. Yeah.
Yeah. Even the self-care, right? Of how much sleep or how much downtime. It's really, really basic things were just not possible for them, and therefore not taught to us. So for us to be able to change that story in, by those that we help, and also those our family, it's very empowering to shift that mindset. And just as I think, just as empowering as learning, oh my gosh, this is a trait that benefits communities, that has helped societies to thrive and to survive. So is this understanding of the physical piece, that our bodies are just doing more. And so
That's
they
it.
just different care. That's it.
It's that basic.
Hmm.
Different body, different level of care, right? And it is something that our parents had no clue about, right? I mean, mental health in general was not even on the radar, let alone looking at temperament and nervous system wiring and just these physiological needs. So this is a good reminder that we need to take care of our physical needs so then we can take care of our emotional needs and we can show up for that purpose for our communities because we do have a very specific reason to be here.
Yeah.
This trait has survived
For a
however
reason.
long for a
Yeah.
reason. Exactly.
Yeah.
Yeah. Mm. So just to, and there's some noise outside. I apologize for listeners. Um, just trying to take in what you're saying because it's such an important message. So if we want to feel our best, we want to actually have energy, we want to give ourselves a buffer against that almost seems like inevitable burnout. What are some of the basics that we should be doing, would you say? We talked about
Yeah.
nutritional supplementation. What else would you put into that on that list?
So before I go through some of this list, I just want to make a blanket statement that very gentle and simple things go a really, really long way for sensitive people. So this might sound too basic or oversimplified, but sensitive people most often thrive with the most minimal and natural interventions. Is that always the case? No, I certainly am not here to preach that, natural approaches are always the answer for sensitive people. Absolutely not. Integrative, use all the tools, but start super, super basic and as natural as possible, and then go from there.
I mean, it's such a good reminder because we are more emotionally perceptive, visually perceptive, but I think our bodies are also more perceptive and just soak up whatever we're giving it like a sponge. So
Yes.
yeah, start small.
Yes. Yes. We have a very narrow window of optimal functioning. And, that can feel really frustrating when you're the sensitive person. Um, and maybe even to providers that are not, compassionate of that experience, because that's where medical gaslighting comes into play. We know we're outside of this little window. And so we're like, something's not right. I don't feel well. I got to talk to somebody. Then they go talk to somebody and they're like, your labs are perfect. So we have such a fantastic tool within us that is so advanced that modern day science, most of modern day science, certainly conventional labs, cannot identify what we are feeling. And so we're great candidates for preventative medicine because of that. Were you going to say
I
something?
mean, truly, because we can detect something before it shows up on the scan, on the blood test. So I think there's a room there to remind folks that self-advocate, right?
Yes.
Find that provider that will listen to you. Like something feels off. Because I've had that too where my labs are all perfect. I'm like, but something is wrong. I'm having inflammation. I need a closer look. And that's why I went outside of the traditional system to
Mm-hmm.
receive medical care. And yeah, just a reminder that, listen to yourself, but also the small, subtle intervention might be enough. And
Yes.
we're
Yes.
really looking outside the box here in every
Yes.
way.
Yes. And if it's still present, keep bringing it up. If you keep bringing it up to a provider and they get frustrated or start invalidating you when maybe they didn't at first, it's time for somebody new, because the right provider is always going to say, we need to keep digging. We need to keep looking until we find that answer. So if you feel like like you're burdening someone, or don't go into the people pleasing, say, okay, thank you, we've done our work. It's time to find somebody else.
This is not the time to people please.
Yeah. No,
Right?
absolutely not.
I mean, because
Yes.
I've heard so many HSPs share that they caught something, a major medical issue, early before their providers would have caught it.
Mm-hmm. Absolutely. Yes. 100%.
Trust yourself.
Yes.
Mm-hmm.
So to answer your question, I
Yeah,
just
thank
wanted to
you.
make that disclaimer,
Yes.
that this might sound really basic, but just beginner's mind, right? Once again, beginner's mind. So my fundamental recommendations are starting with hydration. So there's lots of elements. There's many different ways to optimize hydration, but the reason that it's so important, and I like to include this because my mom used to tell me from a very young age, you need to drink more water, which is interesting because now I'm thinking, oh, wow, she was teaching me how to take care of my HSP needs. But I found it so frustrating because I really like to understand why, and I didn't feel thirsty. So it was weird to me. And so once I really understood, it's like going back to that cake analogy, I have to go back and clean the kitchen. So after each chemical reaction, after each cake that I bake, which is constantly, there needs to be enough water, because that's the most basic form of cleaning our bodies, to get the kitchen ready for my next sensory experience. And so there you can understand why HSPs have a high requirement for water. And it's not just in drinking the water, it's getting the water into the cells. And electrolytes are important in that process, toxicity, mitochondrial function. There's other elements of that, but bare bones, most basic recommendation is hydration. That's
This
basically.
makes a lot of sense because I drink a lot of water every day, but there's a sense of I feel like I'm dehydrated. Like my wife she's not a big water drinker, and I was like, I'm drinking water all day long from time I wake up till I go to bed. And it's like, okay, this makes sense because I'm thinking about how the brain cleans itself while you sleep.
Mm-hmm.
But I hadn't really thought about how your body is needing to do that detoxing all day long. And what's the vehicle for that? It's water.
Yes.
Needs to flush through. And the more water, I've forced myself to drink more water, and my digestion's better.
Yes.
My energy is better. Like I notice a
Yes.
difference.
Yes.
It
Yes.
was
Yes.
surprising.
In the energy module of the program, of the Thriving Sensitivity program, that is the first thing that I talk about under energy, because almost
Okay,
all sensitive people have, wish they could have more energy, because
that makes sense.
yes,
Okay,
yes.
all right. I love it.
And I too feel, I'm drinking water constantly, and it's like, I mean, the demand is so high, and I live at altitude. So that just adds a whole other element of complexity. But it's so critical, and it's so basic, and understanding. I hope that, explaining it in that way is helpful for those sensitive people out there like myself, who really like to understand, why am I doing this? So hydration first and foremost. And I love what you said about, you know, regeneration and healing of detoxification of the brain and the body during sleep. Dehydration can cause sleep disruptions, because if you don't have the water, the cleaning supplies, then you end up waking or not having very restful sleep, because the whole purpose of sleep is to detoxify and regenerate tissue. So if you don't have the necessary tools to do that, it's not going to feel restful. So that's the next thing that I was going to mention, is optimizing your sleep. And that's definitely sounds much easier than it is, right? I mean, it's a checkbox, but it's a whole process underneath it, of that we oftentimes do best when we collaborate with a provider that can help to, use a scientific method to help go through what's working, what's not systematically. Bowel movements are another thing to keep track of. Regular, easy, uneventful, fully formed bowel movements at least once a day. Every time our digestive tract turns on, it is moving all the way through from mouth to out. So if you're eating a meal, then technically we should be moving another meal out. So some people feel best when they have 3 bowel movements, but my absolute minimum for everyone is once a day. So if you're not having a bowel movement at least once a day, that's a form of constipation, even if every other day it's an easy bowel movement. So people think of constipation as it needing to be difficult to pass or dry. It doesn't necessarily have to be that. It's more about how frequently are you removing waste from your body, because the longer it stays in your intestines, the toxins get reabsorbed back in. And that just puts extra burden on your body to have to do the same thing twice or 3 times.
It makes sense, right? As things come in, they should go out.
Yes. Yeah.
Feels pretty simple.
Yeah.
So we
Yeah.
have hydration, sleep, bowel movements. Anything else that feels essential to focus on?
I mean, those are really super basic and important. And I would encourage people to take their time with this. So that's one of the things that I really like. I really pride myself in. I saw somebody this morning and she said, I'm such a bad patient. I didn't do anything that we talked about. And the first thing I said to her was, absolutely not. There are no bad patients. It's that we didn't identify your needs accurately. And because of that, we didn't make a plan that was actionable for you. And so that's very important with these 3 things that we just discussed. It's, our brain can think, oh, they're so simple. I should be able to incorporate them quickly. And that is a disservice to your process, especially as sensitive people, right? So starting with something as simple as adding 2 extra ounces of water, starting by measuring the water that you're consuming and then adding 2 extra ounces and slowly building up to what's ideal for you.
That makes sense. Start small, something that you can actually accomplish
Mhm.
instead of putting all the pressure to do all the things at once. Because, yeah, sleep and digestion are pretty foundational, but those are big mountains to climb, depending on what's going on.
Yeah.
But starting with hydration could impact both.
Yes. Yes. And sleep especially. I mean, sleep
Mm-hmm.
is notoriously complex
Mm-hmm.
for people. The only other thing I would add is trying to rely on food as much as possible for nutrients like vitamin C and magnesium. I'm not saying that there's anything wrong with supplementation, but there is a certain leverage that we get from food because food comes with the other nutrients that make it easier for those vitamins to be absorbed and to function.
Yeah, you get the whole package,
Whole package.
all
I
the
love that.
components, yeah, that you need to actually utilize those nutrients. Yeah, that makes sense. Well, Karen, we're getting close to time, so I just want to see, you've shared so many valuable pieces of information today and really, I think, widen the scope of how do we take care of ourselves as HSPs? How do we tap into the strengths of our sensitivity, the value that we bring? Yeah, I just want to see if there's any final messages that you want to share.
Uh, Definitely that the burnout experience is solvable. Even if you're in that place of feeling really helpless or hopeless, there is nothing wrong with you. It's to be expected that, given the wear and tear, as we've discussed today, on our sensitive bodies, that burnout without very specific intervention is, I mean, it sounds daunting, but it's almost inevitable for all of us as HSPs. I mean, it certainly has been my experience. And so just knowing that, tuning your instrument as an HSP requires special knowledge that we just it hasn't been given to us, and it is available for us. And especially finding that right practitioner can make a world of difference. I think that's a really important message, because I hope that sensitive people can start to fine tune their instruments, because I feel like our world, more than ever, at least it feels that way in my lifetime, is in need of our beautiful melodies, right? That our tuned instruments can play. So that's really an important message. And that's why I developed the Thriving Sensitivity program, is to systematically present these things in actionable steps, in ways that feel digestible, and run the gamut from, interpreting conventional labs and specialty labs, and really being able to feel empowered in our own health. Because even though there are providers that can help, it is always my goal in working with sensitive people to get them to a place where they become their own doctors, with some guidance and some adjustment, always knowing that they can come back. But the idea is, we have all of the information inside. We just need that practitioner information of, oh, well, what test is it, or what nutrient is it, and how do I assess that? And that was my goal with the Thriving Sensitivity program, is for people, sensitive people, to feel empowered with their health, and learn how to do that in a manageable, digestible way.
I love that because so many clients that I work with are trying to do that, but not having the guidance, the resources, or the understanding of being able to put that clinician hat on. Because we really are so gifted at knowing what our bodies need that we can really heal ourselves. And you're right that we are all susceptible to burnout just because of the way our bodies function and the world that we live in and that mismatch. But there's a lot we can do to actually find that balance, and we can actually thrive. Which I love that that's the word you put into the program, the thriving sensitivity, because it's true. I think we think those two are opposite, but they
Yeah.
can, sensitivity and thriving can coexist. So I'll be sure to share that link in the show notes for folks who are looking for that support. Also share your social media, your website, and the quiz as well. Yeah, so I just want to thank you.
And
Yeah.
the 15% discount for anybody who
Oh, great.
puts that in. I think I can share that code if I haven't already with
Perfect.
you.
And I'll make sure I share that in our outro so we folks can have that.
Sounds great.
Wonderful. Thank you so much, Karen.
Oh, this was
This is
wonderful. I feel
great.
so seen and understood. It's so good.
I know. I was so excited for this conversation and just really cracking open this other layer, which we don't hear about a lot in our community.
Yeah,
Yeah.
I'm happy to chat with you anytime about all
Yeah.
of the things that I nerd out on
I know.
today.
I feel like we could pull on a lot of threads.
Yeah.
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 Yeah, I'd love to. All right.
Well, thank you.
Yes, thank you.